and it's my pleasure and honor to chair this session that is dedicated to the New Investigator Award in Clinical Research. We received this year a lot of very good applications for this award, so the competition was high. But I am personally very pleased to announce that the winner of this award this year is Alice Belichat from France. Alice, she worked as a research assistant at the Department of Nutrition and Physical Activity of Pitié-Salpêtrière University Hospital of Paris under the guidance of Jean-Michel Aupert. And the topic of, of her research was the role of physical activity in the management of patients with obesity. Now I know that Alice is moving to another team, nutriomics team in the Sorbonne University. So we expect to have more and more research in the next year. And I am very pleased to have worked with her in a very good group formed by IESO with the aim to produce some statements and guidelines for the physical activity for the management of obesity in adults. So my personal congratulations, Alice. The floor now is yours. Please share your screen and illustrate to the audience your research.
Thank you, Luca, for the nice introduction. Good afternoon, everyone. I'd like to thank, of course, the EASO for this award, and thank you all for attending this talk. So today I'm going to present some of my work on physical activity in the management of patients with obesity. So I would like to start with a few words on my background. So as you can see here, I played tennis a lot when I was younger. And during these years, I really experienced the importance of diet in sports performance. And so quite logically at the time, I started by studying dietetics and then sports science. However, I always had great interest in physical activity, nutrition, and health. And so I also had a degree in patient education. Then after my studies and 2 years as a research assistant, I had the opportunity to do a PhD in 2 different and very complementary teams. The first one is supervised by Professor Jean-Michel Aupert. It's a clinical team based in Paris in Pitié-Salpêtrière Hospital. And this team is specialized in obesity, clinical management, and physical activity and health. The second team, supervised by Professor Pierre Portero, is an exercise laboratory based in Créteil in France and specialized in biomechanics, movement analysis, and exercise physiology. And I really benefited from both these experiences, for my PhD. So as you're well aware, physical activity is universally promoted as an essential component in the management of patients with obesity. And in specific contexts of obesity, such as bariatric surgery and rare forms of obesities, patients are also encouraged to increase physical activity. But we feel that there is a need to better define the clinical benefits of physical activity for these patients. So today I will focus on 2 of my research objectives. The first one is to better define the benefits of physical activity after bariatric surgery. And I will present some data of a systematic review and of a randomized control trial. And the second objective is to describe physical activity patterns in patients with severe obesity. And I will show some accelerometry data. So in 2018, I performed and published a systematic review and meta-analysis assessing the effect of exercise training after bariatric surgery. 15 control trials were included in the meta-analysis, of which 5 assessed endurance training, 2 resistance training, 7 assessed a combination of endurance and resistance training, and 1 assessed postural control training. Our main findings were, so when we compared patients who underwent bariatric surgery and participated to an exercise training program after surgery, with patients who only underwent surgery and received usual care, no training, we found an additional weight and fat loss of about 2.5 kilos in the exercise group compared to the control group. We think that this additional weight loss is moderate, but it is significant. We also found a significant effect on physical fitness, but no clear effect on habitual physical activity or quality of life. Here, I would like to emphasize the heterogeneity between the studies and between the interventions. So this is all the individual studies included in the review. Here, the S is the time of surgery, and the line represents the duration of the exercise program. So there is large heterogeneity. The median duration of the programs was 3 months, but it ranged from 1 month to 24 months. And the points represent the assessment time points. We can see that not all of the studies had data before surgery, and very few of them, here and here, for example, had a follow-up assessment. So given the large heterogeneity between studies, some questions remain unanswered to date. For example, what is the most effective type of exercise? What is the best timing of intervention? Or what is the long-term effect of exercise after surgery? Hopefully, more data will be available to answer these questions in the next few years. I also had the opportunity to participate in the analysis of data from a randomized controlled trial published by Jean-Michel Aupert and the team in Paris in 2018. So in this study, 76 women undergoing gastric bypass were included and were randomly assigned to one of 3 interventions during 6 months, the first 6 months after gastric bypass. So the control group who received usual care, a protein supplementation group who received 48 grams per day of whey protein as a protein powder, and the protein plus exercise group, so who participated to resistance training with 3 supervised sessions per week. Patients were assessed before and 6 months after gastric bypass. So the main findings were, here we can see in the light gray bars, we found no change in the loss of lean mass between groups. It was about 7 to 8 kilos. However, we found a difference in the change in muscle strength that increased only in the protein plus exercise group, whereas it decreased substantially in the 2 other groups. So this data really show that exercise training can improve muscle strength independently of lean mass. And the most important is that exercise training can increase muscle strength even during massive weight and lean mass loss. So overall, the results of the review and of this trial show good evidence that exercise training programs are beneficial after bariatric surgery. And I think that patients and healthcare professionals should be aware of the potential benefits of exercise for these patients. They should be aware of the major effect of exercise on physical fitness and really be certain of the importance of physical fitness for health outcomes. They should also be aware of the rather small or moderate effect of exercise on weight and fat loss, but it was significant but moderate. And also we have to say that there is really little data to date on the effects of exercise on weight maintenance after bariatric surgery. Also, considering the major effect of exercise on physical fitness, I really think that physical fitness should be part of the follow-up evaluation after surgery. And finally, the programs that included endurance and resistance training were the most frequently performed and are usually considered as the most effective in this context. Here, very briefly, I will just show some data, some accelerometry data. So this is this study show secondary analysis of the same trial I just presented. So in this trial, patients wore an actigraph accelerometer during 7 days. And as you know, accelerometers provide minute-by-minute data that we can use to measure the duration and intensity of physical activity and sedentary time. But they are also very useful to perform bout analysis and to better describe the physical activity and sedentary patterns. And the results that we found here were quite surprising to me. we found that more than 90% of total moderate to vigorous physical activity was spent in short bouts of less than 10 minutes. So this was the results before surgery. And almost 40% of patients did not engage in any MVPA bout of more than 10 minutes during the week. So these findings really show very sporadic forms or patterns of physical activity in patients with severe obesity. I really think that the objective assessment of physical activity with accelerometers provides useful insight into physical activity patterns, and that these patterns should be taken into account when defining physical activity guidelines or designing physical activity interventions, or even for providing individual physical activity advice. And finally, considering the really sporadic form of physical activity in patients with severe obesity, increasing habitual physical activity level after surgery may not be sufficient to obtain similar benefits as those obtained with exercise training programs. So I think patients should be encouraged both to increase daily physical activity and to exercise regularly. I will just finish, just say a few words. I had the great opportunity to participate in this EASO group with all these great researchers listed here. We have been tasked to define physical activity guidelines for the management of adults with overweight and obesity. And hopefully we'll be able to present these recommendations next year in Malaga. I would like to thank all of my colleagues in Paris from Pitié-Salpêtrière Hospital, from University Paris Créteil, and especially Professor Jean-Michel Aupert, who has been my mentor on this topic of physical activity and health for many years now. So thank you, everyone. Thank you for attending this talk, and thank you again to EASO for the award.
Thank you. Thank you, Alice, for this very impressive work. We have a question from the chat, from the audience. Do you have any idea what might be the best exercise prescription in terms of the mix and timings of bouts for those post-bariatric surgery patients?
Well, for daily life activities, I think we should really consider the fact that most physical activity is performed in very short bouts. So maybe the objectives at the beginning should be rather moderate, maybe 10 minutes at a time or 20 minutes, but not 30 or 40 minutes because it might seem too difficult. But for really exercise training programs, I think 30 minutes or 40 minutes is possible. You just have to be careful with the intensity and be sure that the intensity is moderate to be able to perform that.
Thank you. My general comment, I asked to you if you agree, is that probably we need to give more value to the importance of physical activity on physical performance and fitness than on weight loss.
Yes.
Do you agree on that?
Yes, I really agree, because it's really the major benefit. It's consistent, and it's probably very important for physical functioning, for healthy living, and for health outcomes. We still have to prove that, of course, in this very specific context, but we know that cardiorespiratory fitness or muscle strength is associated with better longevity or less chronic diseases. So I think it's a really important, and I'm not sure physicians or clinicians know that. So I think that's the message we have to.
It's a very important message. So I think that we need to close. Thank you again for your presentation here, and my best wishes for your future.
Thank you.
I hope to see you in the next time in Malaga, for instance. And thank you to the audience. We will move to the next session of the Congress. See you soon.
Thank you, Luca. Bye.